Today I want to talk about upper ab gripping. This is a tightness right here in the middle area. You're always pulling in or over-activating these upper abs. And this can cause a lot of issues. And I'm just going to talk about breathing for a moment. But when you have a tight grip in that area, you're not going to be able to allow the rib cage to expand out laterally. So therefore you start to breathe more shallow or even start to do more of a paradoxical breathing pattern, which is a reverse breathing pattern. This creates more of a sympathetic nervous system state in the body, that fight or flight. It keeps your nervous system out of balance. So one thing I like to do to help overcome this is I like to do a little bit of skin rolling at night. This is a physical therapy technique where you can start to roll the skin around your belly and get the fascia to loosen up. Then I'll hold that area and I'll work on my 360-degree breathing. Breathing in, expanding the ribs, opening up laterally, and then breathing out. I like to do a 4-8 breathing rate. So that's a 4-second inhale through the nose and an 8-second exhale. You can do it out of the nose or out of the mouth. Either way is fine. But what we're trying to do is we're trying to break up this tight fascia that is allowing the rib cage to become an actual cage and keep us from moving that respiratory diaphragm. Why do we need to access the respiratory diaphragm? Because there's a hole, there's two holes actually, that pass through this very unique muscle in the body. I think of it as like the mothership of all muscles in our body. And if we're not using or activating that muscle correctly, we are not getting the most out of the cardiovascular system, because what passes through that muscle is our connection to our heart. That's why when you breathe, it can upregulate your heart rate and your blood pressure, or it has the power to downregulate your heart rate and your blood pressure. But also there's another hole in the respiratory diaphragm, and that hole allows the vagus nerve to pass through. The vagus nerve is primarily connected to our parasympathetic nervous system state. This means it accesses or allows you to access that rest, digest, restore, calm, recover. So we need to be able to access that. If you're not using your respiratory diaphragm correctly because you upper ab grip, or also known as hourglass syndrome, but if you're really tight up here and you've been holding your breath a lot, we got to get this to loosen up. And this is one of my favorite ways to do it. Gentle skin rolling. You're kind of pulling and rolling your fingers, trying to lift that. There's levels or layers of the skin, and you're kind of lifting it up, and you're working some of that connective tissue that gets really tight. So if you found this tip helpful, go ahead and like, comment. Let me know where you're coming from. Let me know if you have any more questions about upper ab gripping. I have overcome it myself. And I know that when you're upper ab gripping here, your lower abdominals go dead. They're super weak. They're deactivated. So usually that can create a little bit of pooching. Sometimes it'll create some low back pain when you're constantly upper ab gripping. And we want to be able to use both our obliques and our transverse abdominals, our pelvic floor. We want to be able to access those muscles too, and not let these upper abs kind of dominate and grip. So that's one of the reasons also why it's helpful to work on opening up this area, getting more rib mobility, but also allowing yourself to access some of the other abdominal muscles. I hope you found this helpful. If you're interested in coaching and you need a little help, I have two amazing programs. Breathe Well, Live Well is to help people with anxiety, specifically air hunger and breathing pattern disorders, panic attacks that create a lot of anxious breathing habits. And it's an 8-week program to help people with that. The other program I have is for pelvic health. This is for men and women who've experienced pelvic pain. And we also work the breathing pattern to help you manage pressure. So you're not putting pressure down on the pelvic floor. You have a strong pelvic floor that's not overly tight or overly weak. And that program is called Breathe Pelvic Health. That program is another 60-day program. Both are virtual, and if you have any questions or just want to jump on a call with me, I will link a discovery call, little link. You'll go click on it and you'll jump on my schedule. I can offer that right now. I might not always be able to offer that, but for now I can offer a 30-minute discovery call for just a live chat with a coach, because I really do care. And I really care about how you're breathing. And I'm a little concerned about how everybody's breathing. So if I can help some people and then you help the people in your life, we can all get better breathing habits and breathe and live more well, more whole. So that is my goal here at Breathe Well Coaching. Have a wonderful day. Bye.